All right.
Okay.
Hello, everybody. Welcome to the Pelvic Health Explorers August edition of our interviews. And today I am beyond excited to have Tara Morrison with us talking about somatics and pelvic health, a body mind approach to helping clients heal their physical symptoms by addressing the deeper emotional root cause. Tara, welcome and tell us a little bit about
Sure.
yourself and how you got started in this wonderful field of somatics.
Yeah, totally. Well, I am a physical therapist. I have been a PT for 14 years. I have my DBT. And, I thought I wanted to start in sports medicine. Well, that's where I did start. I thought I wanted to be kind of your general ortho sports med PT. And even starting in school, I first had this like inkling around wanting to work in women's health. So that had kind of been there, but I didn't dive into it right away. And in the clinic I worked in, I kind of started seeing all of the hard clients. It's like all of the people that weren't really sports medicine that came in, they funneled to me as the new grad. And so I started seeing a lot of people with chronic pain and just really started to see that this while the skills I learned in school were great for sports medicine conditions and orthopedic conditions, there was more going on and I didn't fully feel prepared to handle those clients. And so at the time, I was like, I've always been a very spiritually minded person. So at the time, I was deep in my own yoga practice and really feeling how that was benefiting me personally. And so I'm like, I wonder if there's something to like mindfulness and yoga and how I could potentially pull that into helping these clients that feel like they need something more to manage their pain. And so that took me into taking some courses on meditation for chronic pain. I went into Ginger Garner's medical therapeutic yoga program. I completed that. And then that took me down this winding path of like wanting to learn more about Pilates and like a deeper core work and like understanding how that plays into the whole picture. And so then I went in and apprenticed at a Pilates studio for 6 years, and got certified in Romana's Pilates. And during that time, still kind of pulling in some of the functional medicine and integrative tools I learned with Ginger, um, and and started learning some stuff around postural restoration institute work and the nervous system and polyvagal theory, and just starting to like branch out of really understanding these other pieces that play into someone's health and wellness. And then while I was at the Pilates studio, I started, becoming more interested in pelvic floor work. And I got pregnant myself. I was starting to refer clients out to a pelvic floor PT that were coming into the Pilates studio. And she's like, "Oh, you're sending me the perfect people. Like, you're totally seeing like who needs pelvic floor work." So I was like, "Okay, good." I'm like going at it, from that direction. And then I got pregnant, had my kids, and that's when I decided to have specialized more in that pregnancy, postpartum, pelvic floor realm. And after I had my first, this is kind of a long-winded story, but I feel like it's all important.
You,
That's when I went into it. It just felt like something was missing after I had my first. I was back working the clinic, and I was like, something just isn't quite right. Like, and just feeling the fulfillment that I wanted to feel while being at work. If I'm going to stay and not be a stay-at-home mom, I wanted to really feel like what I was doing mattered. And that's when I went into Jessica Drummond's integrative women's health program, just wanting to like bring that coaching piece in and really empower clients. I struggled a lot with feeling like um, if patients weren't getting better, it was my fault. It was something I was doing, that I must not be a good PT, which I think also drove me to take a lot of courses. But it also it made it so I was taking on more of the load and I wasn't really empowering them. And so through Jessica's program, through all of the things that we learned, it really helped. That coaching piece really helped me start to change the way I interacted with my clients and what I was taking on personally, and setting better boundaries and work for myself. And through that program, like the big takeaway that I really took out of all of that in the end, I mean, there's so many pieces that I integrate into my practice, but I was like, the nervous system is so important. It drives everything. It drives the stress response. It drives our hormonal response. And I wanted to like go back and learn more about that. And so it's kind of early pandemic. I had just had my second. Everything in the world was going on with George Floyd, and I was just like, what is my place here? Like, where? How am I going to bring this coaching work into the PT work and make it all make sense? And now I'm a mom, and I've gone through this big initiation portal of like having a challenging birth experience and that bringing up my worth, which is all, tied into feeling like I'm a good PT, right? It really was this like big awakening for me personally.
Mm-hmm.
Um, and so I went back, I was like, I'm just going to go back to polyvagal theory. And I started like flipping through Stephen Porges books and like, what is the development of the nervous system? Like, and it just like hit me. I'm like, oh my gosh, like I am imprinting everything into my children, and this is like the work that moms need. Like we need to be more regulated. We need to be more grounded because we are creating the dynamics that are happening in the world. And so that really empowered me to be like, okay, moms need nervous system work. What the hell does that mean? And so that just took me into somatics.
Mm-hmm.
And I spent a good few years just really diving into Kimberly Johnson's work and taking different courses, little things from Gabor Mate and reading books and internal family systems work, and just really understanding how I can bring that side of it into the coaching piece. So that's kind of how I've gotten here, is through that journey, of really a lot of it my own personal journey, and how that's you know following the inspiration of my clients too and what they need. So
And I love all of this. I think your journey is important. I think all of our journeys are important. And for
yeah,
anybody who's listening to this, your journey is important as well,
yeah,
because it is a journey. It's not a destination, and it's not
yeah,
about fixing anybody. I love that you brought that up. That it's not
yeah,
about being a great PT. We all have such bad inner critics, and we
yeah,
have triggered this
totally.
achieving saboteur that I got to take all these courses and do all of these things. And what is that doing to our nervous system? All of that is born out of the sympathetic system and
Yeah,
really isn't serving us well. And that nervous system co-regulation within the internal family system is so important.
yeah.
I remember my first dip into how we are all together integrative was through John Upledger's work, and
Mhm.
with Jean-Pierre Barral, his work.
Yeah,
I had the privilege of working with them both in the early days,
yeah,
and
beautiful.
my introduction to somatics and the work like that was somato-emotional release
Yeah,
through the cranial sacral world, and
yeah,
working with people and realizing that what we, in some brains they'll call it co-regulation, and others we can call it mirror neurons, but it's all the same thing. And how do we get people to regulate? How do we get people to tap into the right system that they need at the time? And that's what we're going to be discussing today. I'm so excited. So
exactly.
excited. Tell us a little bit more about the field of somatics. What is, like, let's put a couple of operational definitions in place here so people are kind of like feeling and thinking like they're on the right page here with you with what you're talking about.
Totally. So the field of somatic, the word somatics really just means being in the body and being attuned to the felt sensations in the body. So on a nervous system level, right, if we are in a state of survival, so if we're in like fight or flight, or if we're in a freeze response, we're no longer connected to our body. We come out of our body, our mind gets really active, those inner critics get really active. We get connected to the stories and the drama and all of whatever's happening in our life, right? And that further disconnects us from what's actually happening in the body. And so the field of somatics is helping people attune to the sensations that live in the body, right? We know that the body, we have our five senses. The nervous system um, it works off of our senses. That's how it perceives safety or danger, right? And as PTs, we do help people somatically a lot. We help people attune to, can you feel this muscle, right? Can you activate this? But I think we're not really tapping into the deeper somatic system around how we hold emotions or trauma, which if we look at trauma, the word trauma, trauma is really trauma. A lot of people think trauma is events that happen to you. And I know a lot of our clients come in and they're like, I had this traumatic event happen to me, and they're really attached to the story. And again, that's being in that mental realm, being really attached to the story and being in survival, right? We create these identities around being a survivor, right?
Hmm.
And all of these things. And people get really attached to that. When we work somatically, we want to work with what's in the body. And so trauma from a somatic lens is actually the energy that lives inside your body, the energy that started the survival cascade that started in that event. And it's the memory of that biochemical cascade that your body remembers. And when you're triggered, it's that energy. I just like to call it energy. Trauma is stuck energy in the body. So every time you're triggered, it's that stuck energy that's activated. And then that energy activates the stories,
Hmm.
right? And the narratives and all of that. And so it's getting out of somatic work is getting out of the story layer and moving into the body and working with the energy that's held in the body, whether that's a stuck emotion, whether that's trauma, whether that's a belief that we hold about ourselves.
I love that, especially the whole story about this, survival is the limbic system hijacking and keeping the story going, and
Yeah,
keeping the identity gets pulled into it, and all the emotions that
yeah,
come from the limbic system pulled into it, and actually blocking interoception, which is the feeling in the body and the other pieces,
exactly.
and
Yes,
learning how to use those five senses to get back in touch with that,
yeah,
and then begin to figure out, what do we need to do with this? Does it need to stay? Does it need to go? Does it need to change? What needs to happen here?
exactly. Yeah,
What needs
yeah,
to happen here? Yeah.
yeah.
And so, how do you work with people? Like, what
Yeah,
is
that's a great
kind of
question.
like, just tell us a little story about a client or a typical kind of thing that you might see, and how you would work with that so there can be some tangibility to this
Hmm.
wonderful systems that we're talking about here, and how to connect the dots a little bit and to help clients
Totally.
move through.
Yeah. Let's talk about, I work with a lot of women who've had birth trauma. So let's go there because I think
Perfect.
that's pretty
Hmm.
common in pelvic health space. Um, so say someone comes in, they've had this really challenging birth experience. I have modalities where I just work with them through like coaching and doing a lot of like somatic work that's not in the body. And so, I might for those people who are really working, we kind of start in the story level, but then we go
Hmm.
into the subconscious and work deeper to pull out the most important parts. But even if you're not doing that, of just guiding them like into, I hear that this was like really challenging for you, right? And people might start crying, right, while they're telling their story, or you can see that they're like kind of fidgety or they're a little bit shaky or there's some like anxiety on the surface, right? Or even if someone comes in and they've like rushed into the clinic, and they're like, it's that noticing of like what's happening in their system, right? Noticing that they're not regulated. And then I'll use to say, okay, like let's just take a minute. I want you to like ground into your body, and I'll take them into feeling their feet on the ground and feeling their hips in their body. Sometimes I'll connect to the five senses.
Hmm.
And then I'll say, let's just go into your body. You don't need to change your breath, but like just notice how you're breathing. Notice what else is in your body. Are you, feeling, is there any sensation here? What is that sensation you're feeling in your body? So really guiding them into what's happening. I know that life is crazy and kids were late to school and whatever, but like what's actually happening right now. So I'm constantly pointing people throughout the time we're working together, like, okay, this is what you're telling me, but what is your body feeling? And so then they start to learn, their nervous system is like, oh, let me pay attention in here. So some of it is like we have to, so much of us are externally oriented. So that
Mhm.
means our nervous system is orienting to what's happening in our external environment, right? And so it's just that, like, how can we point people back? Like, what's happening in your body? What are you feeling? And so I always do that, like when I'm doing internal work as well, right? So if I'm working with someone internally and, or maybe you're working on someone's C-section scar, right? And then they start, oh, I just had this memory in my birth come up, or I'm like starting to feel a little emotional as you're working on my body, right? That's because the energy is stored in the body, it's stored in the tissues. And this is why I think as PTs, like we need to know how to work with the emotional body because we're tapping into it every time we touch a body, right? And I think not doing that, I think it's a disservice to not. And I think there are a lot of people that are like, emotions are not my, like, I'm a PT, I don't deal with emotions, right? But it's like, no, we're touching bodies. Like, we're going to be bringing things up for people. And, there are ways to, like, you know, be like, oh, I don't deal with that. But I really think as PTs, we need to be embracing emotions more because of this. So you might be working on them and they have something come up, right? And I try to just say, hey, like just let the story go and feel what's here. Like just this is for you. This isn't anything to be afraid of. Just like let the emotions, can you just like let the pure emotions flow here? Can you like feel the grief that's here and connect to that? Right. So that would be like a really simple way of just like honoring what's coming up and just being the story doesn't matter here. Let's just feel what's here, what the tissue is bringing for us. And when I'm working in the pelvic bowl, for example, if there's like tissue that's not responding, I might, and I love the work of Tammy Lynn Kent of how she has kind of mapped the pelvic bowl. We know the right side of our bowl is more masculine, left side is more feminine. And so we can start to pull in different, like ask them different questions, like how are things going at work for you? Or how are you feeling around your mothering? Or there's a pocket in the pelvic bowl that I know is like very tied to generational people pleasing. I've seen it so many times now that I'm just like, this is where it's held. I'm like, tell me about that, and then they go in and talk about it, and we can kind of, okay, well, this is what's here, and let's feel what's coming up in your body. And then that's when I pull in some somatic internal family systems work. So doing like, is this a part of you that feels this way? And potentially even going into, is there an inner child here that needs some comfort? And let's work with that inner child. And as we work with that inner child and that deeper inner wounding, then the pelvic tissues just release and open. It's a really beautiful thing for those like stuck tissues that are very protective in nature that, you're like, why is this not, not releasing? So
Yeah, no,
yeah, those are some ways that I work with it.
yeah, I love this on a lot of levels. First of all, I think I want everyone to hear is that the language that you're using is very non-judgmental. You're not entering
Yes.
your own stuff in there. You're just allowing people to feel what they need to feel. And
Yeah.
it doesn't mean you have to know how to work with that. You just need to let them feel it and
Yeah.
be a safe container for them to do it.
Yeah.
That's what people need. They need safety. They need it to be relevant in order for things to be consistent or in order to
Yeah.
step up and to change. Like even in polyvagal theory, we may need to help somebody, polyvagal theory will talk about waking the system up, but only if safety is in place first.
Yeah.
Because they're not, if they don't feel safe to kind of like come into that
Yeah.
social,
Yeah.
expression of the higher level of the nervous system, then they're not going to do it. They're just going to,
Oh yeah,
give it back in the
or
whole
they'll
time.
touch there and go back in. I mean I've noticed that on my own journey, right? It's like I'm like, oh, I'm so regulated, that I'm shit, I'm not like,
I
it's
don't
like,
know if
oh
I want to
gosh,
do
we got to keep building that safety, but
right.
it comes with time.
The story of the C-section scar is probably one of the most tangible because I think
Yeah.
everybody knows there's stories around Achilles tendinopathies and
Yeah.
there's stories around C-sections that are quite different,
Yeah.
and have more layers, in my opinion, than
Yeah.
we give credit to. And I know that, I think that everybody that's listening to this and has worked with C-sections understands that people do not only do they not want to touch their C-section scar, they don't even want to think it's there.
Yes.
They want to
Yeah.
completely, but if there's like a complete block around it, they don't like it, they don't want to feel it. But
Hmm.
yet when they talk about it, there's a lot of emotions and things that start to come out. And they're
Yeah.
used to like living in the story and not being in their
In the
body, that
body.
particular side of their body. And there's so many layers to it and so many ways to work with it in safety. I know one of the things
Hmm.
that I still do and still tell people to do or work with people as they do it is like, you don't have to touch it. Let's put a towel on top.
Yeah.
Let's
Yeah.
put a pillow on top. What do you need? How much layers of barrier do you need
Yeah.
to just set your hands on top of that there? And can
Yeah.
you get comfortable and do that part? And, as
Yeah.
they kind of work through all of that, again, what's going on? What do you feel? It's
Yes.
okay.
Yeah.
And, just even the stories about, in the pelvic bowl, I think are important. And as a pelvic health practitioner, I think one of the things that I want the listeners to get is you don't need to spend time with their story around
Hmm.
that, but this is the person that needs to have support. When they're
Yeah.
talking about, there's a lot of back history that's tied up with your pain. There's a lot of back
Yeah.
history that's tied up with what's happened to you, with the trauma, with the things. What kind of support do they have? You don't have to be the one, but you need
Yeah.
to. This is a beautiful way for pelvic health practitioners to recognize this person could really use support in this trauma area.
Yeah.
And who
Totally.
do I know that I can send them to that would work with them in a way that's going to strum their central nervous system? And I've
Yeah.
always said to PTs, you need to have a web of support of practitioners for referral. And
Yeah.
because like
Totally.
you talked about, I don't want to deal with emotions, and it's like it's not. You don't have to. You don't have to. You don't have to be trained to deal with emotions, but you need to recognize them and allow your patient to have them.
Yes.
And if they need
Exactly.
more support besides what you can give them, then it's incumbent upon us to recognize that within ourselves, whether is this
Yes.
my thing that I'm going to be doing with them, or as this comes up, this is what I want to communicate to the other
Yes.
practitioner, whether it's a
Exactly.
somatic coach, whether it's a mental health therapist, a cognitive behavioral specialist, a
Yes.
mindfulness practitioner, whatever it is. And that's where that nice collaboration can come in because then it's patient centered and not
Yeah.
practitioner controlled, which is nice.
Exactly. Yeah.
Mhm.
Yeah. I have a really great example of that actually. I had a woman come
Mhm.
in. She'd had a traumatic birth experience, but she had a history of some sexual violence in her past, and just, a lot of other, some interesting like bladder incontinence with anxiety, like since she was a little kid, that she still had. So it wasn't like her incontinence was new, it was just worse. Um, and so, as we started, we did a lot of like somatic work before we ever did internal work. And the internal work was actually very triggering for her.
Mhm.
And, a lot would come up with that. And we were just, I was like, I think you need, like, we need, this is going to be a journey. Like, this is not a quick fix for you. Like, this is a journey. And I
Mhm.
referred her to a friend who's a somatic therapist. And she worked with her, started working with her very consistently, did some like psychedelic sessions. And like, so now she'll come in and she'll be like, okay, like she still gets a little triggered, but like she has the capacity to like work through it and move through it. And I know how to hold her in it and, alchemize what comes up. So, it's been really powerful for her to be able to work on something that's had so much control over her life, but it has taken that team approach. Like she needed that really dedicated therapy, right, in order to have the nervous system that could tolerate doing the deeper somatic pelvic work to that I'm doing with her so she can learn how to feel that stuff and not have it overwhelm her system essentially. So and not every PT is going to want to do like what I do, where most people probably
Right.
wouldn't feel comfortable taking a client there, right? But I that's what I do. So
Yeah. And I,
yeah.
and I think that's so important is that wherever you are, at whatever level, if you're going to work with humans, you need to recognize emotion
Yeah.
and recognize when it's they are safe enough to allow it to go, or if it's emotion that keeps repeating, it might be something that you need more support than the physical support I'm giving you here. This has
Yeah.
started the journey for you. There's a piece of it over here that needs to be taken care of too. It's one of the things that comes up in GI health all the time. And
Hmm.
finally, I mean, the hope for us all is that finally, even Rome, the newest Rome Foundation, Rome 4, has finally identified that, any type of chronic functional gastro and dysfunction is a gut-brain axis problem.
Yeah. Yeah.
And this, of course, medicine support is, going to be more geared towards prescriptive types of things. But, recognizing the fact that if we're dealing with, constipation, like chronic constipation, bloating, distension, that's a system that has gotten so loud finally that the,
Yeah.
the pain and the lumen from normal stretch is what's getting their attention. And that's the
Yeah.
system that's in so much trouble, but the interoception for so long has been gone. And
Yeah.
then it comes at them with this huge bang. And I can tell
Yeah.
you, every IBS patient client that identifies in that IBS type of world, always, there's always some sort of adverse event that has led up to this. And
Yeah.
it doesn't have to be just emotional. An illness can do it.
Yeah.
A
Totally. Yeah.
traumatic injury can do it.
Yeah.
Um, Actually, even things such as grief of losing a loved one,
Yeah.
or a very big internal tribal thing, or cultural thing, or even just with their family. Like, you know,
Yeah.
I, I know that following weather disasters,
Hmm.
there's
Interesting.
always a number of people who may have been more traumatized because of it, like loss of home and loss of
Yes.
family,
Yeah. Yeah.
all the different things. And I think, if we're going to work in this realm, we need to recognize that if I'm not the one to help them integrate this mind body approach into their things, they need somebody who can, because we're only
Yeah.
treating one part of the axis if we're doing that.
Yeah.
Early on, we
Totally.
move into hormonal health and nervous system regulation, so you're talking about HPA axis, you're
Exactly.
talking about
Yeah.
the internal stress response system, and how much longer it takes for us to co-regulate out of that. Like, we can get into the stress response in less than a second, but it
Hmm.
takes almost 10 to 20 minutes to reverse all those biochemical changes again.
Yeah.
And if we're stuck in that story up there's no reason to ever reverse it, because we're continuing
Yeah.
the loop, and then it'll stay regulated, and then we'll stay regulated, right?
Yeah. Exactly. Yeah. My partner in somatic pelvic arts, Ryan, she was just telling me about the new like psychoneuro what is it? Psychoneuro endo immunological system, right? Where it's all connected. But our cells are constantly, evolving, but it takes 7 years, right? I mean, we know 7 years, but that for cells to evolve, but it takes that long to see like full change in the system,
Mhm.
right? In that whole interconnected system. And everybody wants things to happen so fast. It's like it's actually going to take time because everything is so interconnected, and obviously you can make little gains over time, but to really have a refresh of that whole connection, it takes a long time of
Yeah,
dedicated
it does.
healing.
It does, yeah. The psychoneuroimmunology piece is still in its infancy, and
Yeah.
we're just beginning to understand even things like peptides and stuff that can be helpful,
Yeah.
and what's going on those levels, on all of the different things, and why insulin sensitivity comes up at certain times and not at other
Yeah.
times.
Yeah.
All of those things. And so, what we're used to doing is treating the outer lane symptoms. We're used to
Symptoms.
treating
Yeah.
the incontinence. We're used to treating the diabetes. We're used to, instead of
Yeah.
going like, how far back can we go? and what can we do, on these things. And I think that leads us back into, when people have really complex clients, you've got to meet them where they are.
Yeah,
You can't,
totally.
this is not going to be, don't be afraid of this. In fact, just doing one thing can start to change the cascade of stuff that started that
Oh,
happened.
yes, totally.
And everyone
Yeah,
wants to do 20 things, it's like, no, no, no,
yeah,
no, don't co-regulate with them. Don't get ramped up
yeah,
into their hijacked story, but instead, what's the one thing that they can do that they
yeah,
can start to change it? And which string do they want to pull first? And,
yeah,
and what you're talking about is beautiful because you're just spending time with them in what we consider, true mindfulness, which is activating one of the five senses, but in such a way, there's such a tension on it that their neural pathway will switch and
yeah,
they will start to gain, how many people can't feel their pelvic floor? You
yeah,
know, is that a neuropathy
totally.
problem? No, they've got muscles, their
No,
skin is good, their circulation is good.
yeah,
It's not a
yeah,
neuropathy problem, it's an interoception problem.
yeah,
They've
yeah,
blocked that out for a
exactly.
reason and they
And
need.
often there's, yeah, and often there's like emotional,
Yeah.
like I often, there's an emotional blockage somewhere in the belly, right? Or a solar plexus, or, there's some sort
Mhm,
of emotional block that often I find once that's released, then they can breathe into it and they can feel it.
mhm.
So yeah, it's like, is it the lack of interoception? Probably, that's where like if you just continue to practice, it does get better. But sometimes there is that other
Yeah, and you have
layer
to
to
figure
it
out, like, why
too.
is that there in the first place? So
Yeah,
you can get it
yeah,
somewhat better, but you've got to, like, work through the system too, which is where the
yeah.
breathing comes in, and, like, again, what emotions are happening if their
Yeah.
thorax is stuck, and
Oh
it's not
yeah,
moving, what's going
totally.
on there? What are they feeling? Do they have any,
Yeah,
are they getting more anxious as they do? I know a lot of people will talk about, I can't do breathing with certain people because they get more anxious. And it's like, you might
yeah,
be going 10 steps too far. Maybe they just need
yeah,
to notice what it feels like
yeah,
for the breath in the
exactly.
body. Like, let's
Yeah,
back it up, back it up, back it up, back it up. Because like you talked about, it
yeah,
takes, a long time to start to make a change. We want to be with people like that. We want to be sure that we're going all the way to the easiest part for them. Not,
exactly.
not
Yeah,
triggering their story or their stuff with them, but letting
yeah,
them feel the emotion at that level
yeah.
and that lowest
And
level.
and when we can like clear all that and just get to the sensation of the emotion, right? It's not even just like feeling the grief or feeling
Mhm.
sadness or feeling anger. It's like getting into the sensation level of like when you're feeling grief, like where is that heaviness located in your body? And like being with that, that's the energy, is the sensation level is the energy.
Mhm.
And when we talk about healing trauma or integrating trauma, or, whatever we're holding in the body, right? Trauma is such a big word, but I
Right.
mean, it can be like you were talking about weather events, right? Those things are traumatic, right? Separations from family, those things, I consider all of those events trauma. Like there is some energy that's stuck in the body from those events that have been created, whatever cascade that's probably leading to the IBS, going back to
Mhm.
that piece. But it's like the way we integrate trauma is through feeling the sensation. It's very simple. You don't have to feel it all at once. You can feel just like little bits and little bits. So when you have clients come in and you just like help them be present with what's happening in their body and guide them into just like feeling with it. I like to say, like, can you just sit with this? Like you're observing a newborn baby with some compassion and some curiosity.
Mhm.
And that's it. Like let the rest go. You're just like, oh, can I just get to know what's here and allow myself to feel what I feel like I can feel today? And
Mhm.
that's enough, right? That is
Mhm.
integrating trauma. Like it doesn't have to be more than that,
Right.
especially in this realm with what
Mhm.
people are bringing. It's like, can we just let them be witnessed in that in a safe space, right? Because so many people carry their pain and they're in isolation around it. So just having that, like you holding curiosity and compassion, again, going back to what you were saying around like not needing to fix it or to know where to go with it, but just to like can you hold them with curiosity and compassion like you're holding a baby while they hold themselves with curiosity and compassion? And that also brings a little bit of their higher level um, self into it as well, right?
Yeah,
So then they're
yeah,
not
because
fully like going
that's
into
a
the thing.
that's a sage power of self-empathy.
Yeah,
Uh, the empathized power is one of the most beautiful things about the human existence. And the people who are not able to experience that is, that's part of the continued isolation of a chronicity, the
yeah,
pulling back instead of doing what our biology really needs is to like get support and
yeah,
feel connected and
yeah,
all of those things, and the opposite happens. It's more of a retreat, retraction, hiding, pulling
yeah,
in, that
yeah,
whole dorsal piece of it. And I love that, just letting people just be where they are and not forcing the issue. And
yeah,
as you say, maybe not even going to the area that is going to be the trigger. I think there's so
yeah,
many times that people with chronic pelvic pain, we'll just use that big word. Of course, we know there's, many small parts to it.
yeah,
You
totally.
know, that they don't need to have an internal exam the
Yeah,
first day. They just
no,
they just need to feel safe, and they
yeah,
need to talk.
totally.
I know one of my PT that I've worked with in the past, her thing was great chronic pain,
Mhm,
neurobiology base. And her biggest thing was with anybody with a pelvic issue, when they came into the room, she always made sure, first of all, that she was sitting next to them. And I did that in my practice too. I never sat in front of anybody or up on the bed while they were on the chair.
mhm,
I never put myself in a position like that with them. I was always next to
yeah,
them. But the other one thing that I learned was make sure that you're not between them and the door.
yeah,
Simple things
yeah,
we can do, even just in
yeah,
the setup of our room,
yeah,
right? Like
yeah,
just simple things that don't have to that can speak volumes
yeah,
to our clients. And you mentioned this, the safety and being together and being able to have empathy, that requires for the therapist, I would say, more work on yourself,
exactly.
so that
Yeah,
you are so that you can be in that wonderful neural regulated state when you go into the room, because mirror neurons are important. And if we come in
yeah,
hijacked and our clients are already
yeah,
hijacked, then
yeah,
we're not going to get anywhere.
yeah, yeah, totally. That's when you need to do the grounding meditation for both of you. Which
That's
sometimes
right.
I do that. I'm
Exactly.
like, okay, I actually really need this, and I think they need this too. So let's just do it, and and then we both come into a state of
Yeah.
resonance together. So yeah, and,
Yeah.
and I really, I try at my best unless someone really wants internal work on the first day, but I try my best too to like, this is a journey. We're not gonna like get in there and fix it today. So like, let's build this relationship and this rapport. And I mean, I'll do a full external body evaluation before I usually spend one session focused on pelvic floor work. And,
Mhm.
when I do it for the first time, it's like that's its own evaluation session. And there's so much, at least one or two sessions that you can do before of just, really getting into knowing someone and knowing their system and starting to do like subtle nervous system work, breathing, grounding work, because all of that's going to support the pelvic floor work. Because we know the pelvic floor is almost more a part of the nervous system than it is, just a
Mhm.
muscle, right?
Right.
And
Right.
so,
And
yeah,
and I've always said that manual therapy isn't about it. The things that we do work, but probably not for the reasons we think.
yeah,
And because I think that every time you put your hands on somebody, you're actually having a conversation with their nervous system.
yeah,
The changes that you see, the changes that clients feel are a direct, reflection of the change in the nervous system.
exactly. Yeah,
And, all of it, whether
yeah,
there's more redness to the tissue or there's more, you know, tension let go, or there's more the body, oh, I did this mobilization and their pelvis all lined up. And it was like, I don't know if it was really a biomechanical thing. I think it was what that, that you had a their nervous system changed, it reset.
Yeah. Yeah.
Now let's see how it
Totally.
holds. Because if
Yeah.
there's
Totally.
something else going on there, then
Yeah.
it's not going to hold. And that Jean-Pierre Barral was big on saying there's no such thing as SI joint dysfunction. It's all visceral,
Yeah.
in
Yeah.
a French
Yeah.
way.
Totally.
And,
Yeah.
and underlying that, of course, he meant there's the emotional part
Yeah.
that's tied up with that
Totally.
too, and that
Yeah.
integrated part of the work that he, created and taught
Yeah.
so brilliantly.
Totally. Yeah.
This has been amazing. I
Yes.
love all of this. And Tara, tell us how people can find you. And I know you have a podcast, but tell us how they can
Hmm.
get in touch with you and the work that you're doing.
Yeah. So
Put all
I
of this
have,
in the notes below too.
okay, great. Yeah. So I have a podcast, Pelvic PT's Gone Wild, with my friend and colleague Ryan Simmons. She's also a pelvic PT, and beautiful soul. And so we were having a lot of fun with that. And then we have what's called Somatic Pelvic Arts, which is we have a mentorship program there where we're actually teaching PTs that want to dive more into this, like understanding how to work with emotions and energy in the body. So we are enrolling our first cohort for that now, which starts mid-September. Um, and we'll be doing some other things, retreats and other things through Somatic Pelvic Arts. And we have a community there. It's $5 a month to join that. You get video access to our podcasts, and all of our master classes that we have done are in there. So there's some little things in there that you get by being a member. If I think there's still some space to join for free. If people want to join for free, they can use the code REWILD, and that'll give them free access. We did that for the first 100 people. So I think there's still a few of those left if anyone wants to try to come in for free. And yeah, I'm on Instagram at the Rhythm Mama is my handle. That's where I post my personal and clinic stuff, and my business is called Inner Rhythm Wellness. So that's my personal side of my business as well. So
And on top
uh,
of that, you're a busy mom of two boys.
I'm a busy mom of two boys. Yeah.
And,
Yeah.
just working your way forward and changing the
Yeah.
world. I firmly believe that the more we do for ourselves, the more we do for others.
Yeah.
And the more that we
Yeah.
put and elevate our work and elevate each other, that we will change the way that humans exist. I firmly believe that.
Yeah.
Thank you
I
for
do
doing
too.
your part and showing
Thank
up
you.
and advancing your journey and the journey of
Thank you.
others and joining
Thank
us
you,
today.
Susan. Thank you. Thank you so much for having me. It's an honor to be here today with you.
Awesome.